Yes, welcome back. Now, after listening our lesson about grief and bereavement, we spoke about grief and bereavement in patients and in caregivers and what are the possible options there. But we have now learned that you build up a relationship with your patient to provide the best possible care. And then you lose these patients. So, how should you support the caregivers, professional caregivers, in this sense? That what kind of support is, for example, available in your clinic where you work for yourself and your co-workers, and why is it so important?
Well, actually, when we talk about grief and bereavement, we first have to center the patient. And what we've learned that grief and bereavement appears very early in the disease progression, because the patient has difficulties to cope with the diagnosis. So grief and bereavement is very important to address at the initial or the early phase, because when the disease is progressing, some patients lose the insight about what's going on, like we talked about dementia or cognitive decline or cognitive changes in these patients. We see that the patient needs some people to discuss that one, and how we address this. Like we mentioned it earlier, we are talking about people having kind of spiritual resources, so they might need a chaplain to discuss this, or psychological resources, but they are afraid to talk to a psychologist to that one because they do not feel, and they are not psychiatric ill. However, it might be very supporting, especially when we talk about caregiver and patient relationship, because that's going to be sometimes very difficult because it's a long-lasting disease, so the burden is really high. And we have some, partners who look psychosocial support during the course of the disease. But this also happens much more in the early or, middle advanced phase and not in the last phase. We have in the last phase, it is the burden for the relative is really high because you have a 24-hour job. You're caring about anything you have to organize, and you have to organize your own life. So, and the self of the caregiver more and more goes in the background. So it is a patient-centered living. So what then happens when the patient is dead, and obviously all of us die, then there is a hole. The relatives often do not know how to cope with their own life. So it is important for grief and bereavement not only to care for this during the patient lives, because what we need to do is, even after the patient is dead, to care for the relatives and to follow up them. So what we do is half a year or a year after the death of the patient, we organize meetings to discuss where the relative is standing now, how we can support her or him in the life. Because when you lose anything, it is really difficult for them to get back. And their having a help in their grief and their bereavement means a lot for themselves going on with their life.
Yeah, so now you very successfully avoided my question, because patients and caregivers sometimes think that healthcare professionals are robots and don't have any feelings at all and no compassion towards their problems.
Right.
But I assume that you do. And so how do you take care of yourself? Because you definitely...
Well, yeah. I know.
You feel what the patients feel because you work in palliative care.
Right. What we do is that with our healthcare professionals, we have regular meetings, meaning once a week about special issues, and we discuss all of our palliative care patients, and especially with the neurological patients, there are certain situations which are sometimes much more difficult to deal with as compared to cancer patients. And for that one, we are organizing external supervision for the entire team. And I think this is very important, especially in difficult situations.
Yeah, so you say that it's a program of your workplace, that this kind of support is offered on a regular basis, and it doesn't happen, just in a corridor passing.
No.
Yeah.